Hello, my name's Jack and I'm a clinical specialist physiotherapist working at Wrexham Hospital physiotherapy team. So today we're going to talk briefly around the muscle activation and optimal loading for gluteal tendinopathy, also known as greater trochanteric pain syndrome, and a previous title of trochanteric bursitis. So we're going to start by looking at tendinopathy management and optimal loading and what exactly that means. We're also going to discuss the LEAP trial, which was an evidence-based research project performed in Australia, looking at patients with confirmed gluteal tendinopathy and rehabilitation of these patients, and then looking at graded progressions as guided by your physiotherapist. Tendinopathy often results onto the outside of the hip in two instances: overload, which often is an increase or a sudden increase in the exercises that you're performing, such as a sudden increase in a couch to 5k, for example, or a lack of load. And this can be caused by deconditioning or stopping exercise, which can result in changes to the structure of the tendon and ultimately result in weakness and an inability to perform your previous level of exercise or function, and unable to then progress to your desired level of function, perhaps in the future, dependent on your goals and needs as the patient. The LEAP trial is a study which looked at 204 patients with confirmed gluteal tendinopathy. This study was performed in Australia and it looked at education and exercise in comparison to a steroid injection to the outside of the hip, as well as a wait and see approach, so doing nothing. 74% of patients improved with the education and exercise in comparison to the steroid injection and the wait and see approach, and that 74% was higher than the steroid injection, which is really important when promoting our exercise and performing graded exercise. The LEAP trial looked at education, so looking at not overloading the tendon whilst performing the exercises, as well as looking at a graded and paced approach to exercise as guided by your physiotherapist. Exercises initially normally include static exercises such as a glute squeezing exercise, as well as a glute imaginary splits exercise, both of which use the muscles in the buttock muscle region, and these are performed as guided by your physiotherapist. These can be then graded in the progressions by the guidance of your physiotherapist into a double leg squat exercise, again focusing on the muscles and structures onto the outside of the hip, and a double leg bridging exercise, again focusing onto those tendons and muscles onto the outside of the hip region, more specifically the gluteal tendons, which feed into the pain region onto the outside of the hip. This is all being monitored by the pain levels at that time as well, so we need to make sure we're in constant discussion with the physiotherapist, be that in a one-to-one session, over the phone, or in the hip class. Improvements can be slow but sure, and tendon adaptations and tendon changes can take up to 3 months as a minimum with your rehabilitation and exercise as guided by your physiotherapist to occur. These changes can occur earlier and also can occur at a later stage. However, we normally look at least 3 months of rehabilitation and progression for the changes to occur within the tendon structure onto the outside of the hip. Thank you for listening.